In your health headlines, the weather is heating up, and that means many people will be out soaking in those rays. But people should also be aware of the risks of skin cancer. It is the most common form of cancer in the U.S., with 1 in 5 Americans developing it over the course of their lives. Dr. Mitchell Goldman, you know him as Dr. G from UCSD, is here to talk more about all this. Thanks for being here.
Always good to be here, Kathleen.
Well, throwing out another stat, 2 million people in the U.S. are diagnosed every year. So skin cancer is showing no signs of slowing down. Why is that?
You know, nobody really knows. It's definitely related to sun exposure and to the use of tanning salons, just like smoking cigarettes is related to lung cancer. But there are other factors that are playing a role. One is environmental pollution is definitely affecting skin cells. The other is atmospheric radiation. You know, more radiation, millions of times more, were dumped into the air in the 1950s and 60s during the atmospheric nuclear bomb testing than what was ever done with the minor nuclear reaction problems that have had. And it's those people that lived and were born in the 50s and 60s that are now coming down with cancer.
Very fascinating. Well, most of us think we actually know what skin cancer is, but how does it really attack the body?
You know, skin cancer is basically 3 kinds, and they come from 3 kinds of skin cells. The deadly form of skin cancer, which is going to occur this year in 185,000 people, that really causes at least 2 deaths a day in California, evolves from a mole. And so that's when a mole is becoming darker, changing in color. The other type of skin cancer, called basal cell, is the one that's the most common, occurring in almost 2 million people a year. And that's a sore on the skin that usually bleeds and doesn't heal. And the next kind is called squamous cell carcinoma, which comes from a different cell. So those are the forms of skin cancer. The most important thing that our audience needs to know is if something is changing on the skin, if it's growing, if it's bleeding, if it's itching, it should be shown to a dermatologist, because literally within a few seconds, a properly trained dermatologist or family practice physician or other physician can diagnose whether that growth needs to be biopsied. And then a very simple biopsy, which can be done in a matter of seconds, can actually diagnose. And the key with all cancers, but especially skin cancer, is that if you do an early diagnosis, the treatment is usually 100% curative, even for malignant melanoma. So the key thing is you have to catch it early. Anything that's changing, see your dermatologist. A very simple test can find out if it's cancerous or not.
What are the simplest and most effective ways to try and prevent this? We always hear, you know, sunblock for sure and stay out of tanning booths, but are there other things that we're not doing that we should be doing?
You know, I wish it was that easy that we could say exercise more or eat the right foods, which of course are good for many kinds of cancer. But it's really early detection is the key. Absolutely wearing a sunscreen, not living in a cave, is very important. Not going to tanning salons, just like we don't encourage cigarette smoking, is very important. When you're using a sunscreen, the important thing to remember is that the skin is a large organ, and so you have to put on the right amount of sunscreen. And you want to use a sunscreen with a sun protection factor of 30 or more. That's usually the best. You want to cover areas that you don't think about, like the ears, or if you don't have a lot of hair on your head, make sure you cover your scalp, wear hats, sit in the shade, and just be smart. If you're going to exercise, try to exercise before 10 a.m. or after 2 p.m. And then the most important thing is look for changes. And you know, I have a saying in my office, wives save lives. And usually it's the guy that comes in because the wife said, you know, that mole is changing, you got to go see the doctor. And the guys really don't care. But if the wife nags him enough, the guy will come in and that'll really change something. So look at your significant other, your spouses, examine their skin. If anything's changing, that's when it's time to see a physician.
That's right. And know your own skin as well so you can detect changes. Thank you so much, Dr. G. May is Skin Cancer Awareness Month, so getting the word out.
Great to be here.